Do you have pain on the outside of your foot? Hi, I'm Dr. Dave Candy, and this video is about one really common cause of pain on the outside of the foot and how you can fix it. Now, if you find this video helpful, give it a like or thumbs up and subscribe to our channel so you can get notified of our future videos. So first of all, what causes pain on the outside of the foot? Now, there are several things that can cause it. One is actually a type of fracture. It's a fifth metatarsal fracture, or the fracture right on this bone on the outside of the foot. And if you have tenderness to touch right over the outside of the foot, you want to first rule that out and make sure that you don't have a fracture there. If you can't put weight on the foot and you have some bony tenderness right over that bump right there on the edge of the outside of the foot, you definitely want to get that checked out, have an x-ray, especially if you can't put weight on it, and make sure you haven't fractured it. But assuming you haven't fractured it, some other causes of pain on the outside of the foot, less common ones are referral from the lower back, like an S1 radiculopathy, which goes down your leg and runs on the outside of the foot, or a little branch of that nerve that wraps around the outside of the foot and goes underneath the arch. But the more common cause of pain on the outside of the foot is called a cuboid dysfunction. And that's basically a little bone that sits right behind that bump on the edge of the outside of your foot and between the bump there and the heel. It's a little bone called the cuboid. And how you help if the cuboid is a problem is you just push the cuboid back where it's supposed to be. You see, normally you have three arches in your foot. You have an inside arch on your foot that runs along the inside, an outside arch on your foot, and then one that runs across from side to side called your transverse arch. And if that arch on the outside of your foot, the lateral arch, has dropped down, it can kind of squirt the cuboid out to the plantar or bottom surface of your foot. And then anytime you put weight on that, particularly high impact weight, you can jam that bone. And if it's stuck where it can't get back up into the arch where it's supposed to be, then it becomes painful because you're jamming the bottom part of the foot of the bone and it can't get back up into the arch. And so it's like a hard barrier, like you're hitting a rock up on an anvil or something like that. So how do you fix that? Well, there's a really quick manipulation you can do if you're in the office. But if you're trying to fix this on your own, and obviously you probably are because you're watching a video on YouTube, that you just find your thumb, you find that bump on the outside of the foot, and you can find that with your thumb and then push up the toes around it. So you're kind of pushing the cuboid bone behind that arch on the outside of the foot up back into the arch, and you're pushing the toes around it. Now I'm showing it this way just for the effect of the video, but you can also put your thumb of the other hand there, kind of wrap around this way and pull the toes around like that. And I feel like you can get a little bit better of a stretch doing it this way. But again, either way you decide to do it, whether you push with your thumb there and you push your toes around it like that, or whether you put your thumb across the foot and then pull from the underside with your opposite hand, you're really just pushing that cuboid back up into the arch. Now, that can be a temporary solution, particularly if you're someone who overpronates. If you overpronate and you have tight calves, you definitely want to stretch your calves. It's probably a good idea to have orthotics as well. Not only orthotics that support the inner arch of your foot, but also the lateral arch or the outside arch of your foot, so that you're getting some support underneath that cuboid and it doesn't just keep dropping out. Now, if you do need orthotics that support all three arches of the foot, the inside arch, the outside arch, and the transverse arch, we do offer those here in the office at Morpholife, and you can get a foot scan for free. But you definitely want to get the arch supported, stretch your calves, which I have another video, and I'll link to that so you can find out how to stretch your calves correctly. And do that little corrective exercise that I just showed you to push the cuboid back up into the arch of the foot. Now, if you try those things and you still have some more questions, feel free to reach out and we'd be happy to help. And if you found this video helpful, give it a like or thumbs up and subscribe to our channel so you can get notified of our future videos. Thanks for listening and have a great day.